Good morning, everyone. We're going to go ahead and get started in about 1 minute at 10:05, just letting a few more people join if they're going to join. And then we will go ahead and get started.
Okay, everyone, I think we're gonna get started. Did you want to put up the, so first, maybe Frank wants to put up the, a little, we have, so I just want to welcome everybody to the first of 5, I should probably put my video on, huh? Sorry, I thought I had it on. I want to welcome everybody to the first of 5 ICHC Now is the Time Transformation Toward Equity Town Hall Series. My name is Alicia Martinez, and I'm going to be facilitating today's event. Cecilia Reyes and Diana Zuniga are going to be monitoring our chat box. So if you have any questions or comments, please feel free to use our chat box. So we hope these town hall series serve as a platform of engagement You muted, did you mute me?
I accidentally mute you, I'm sorry. It was my fault.
Okay. So we hope that these town halls serve as a platform of engagement to address the global health pandemic and social justice issues relative to systemic inequities found across health, education, mental health and substance abuse, criminal justice system, and the housing system. So today's town hall, we are going to focus on health. And so our agenda, we're going to have Heather Jew Northover from the Center for Health Equity, and she's going to be talking about health inequities and how to build a change. We're also going to have Diamond Lee from the Department of Health and Human Services, and she will be talking on how to use an equity lens to advance equity in our community. We're also going to have an interactive polling activity and then closing remarks and announcements. So just a couple of housekeeping rules. In recognizing the level of stress and harm experienced by our communities, which may be enhanced by the topics that you're going to see discussed today, we ask that you really be mindful of the following. So first, safety first. We are prioritizing cyber safety during this event, and we'll remove anyone who non-consensually shares anything visually or verbally vulgar or inappropriate. So there will be difficult topics discussed in this event. And so together we are prioritizing the lived experience of everyone, needs of Black and Brown, transgender, gender, non-conforming, intersex, and LGBTQ individuals. Some of the topics may be difficult for some, so please feel free to take care of yourself, step away, if you need to. And definitely we wanna make sure everybody has sincerity and compassion, that we are respectful and patient with one another, especially if we're having any logistical and or technical issues, and then definitely having a positive regard for others. So just a little bit about our Zoom features. In order to support the integrity of the space, we're gonna keep everyone muted unless you're invited to come off mute. Please feel free to come off mute and share. Feel welcome to use the chat function at any time to share or upcoming events. And again, Cecilia and Diana will be monitoring the chat box for questions. So thank you all for joining us. We really hope you find these town halls informative and have a better understanding of the effects of racism and discrimination as it pertains to health in our communities. We hope to hold discussions centered around equity at the local, community, systemic, and global level. We want to celebrate everyone's successes and the lessons we learn. We want to educate one another and create a safe virtual space to have discussions and offer solutions and promote movement toward resolution and accountability. So with that, I'm going to introduce our first speaker, Heather Ju Northover. Heather is the director of the Center for Health Equity, a Los Angeles County Alliance for Health Integration initiative led by the Department of Public Health. Prior to her current appointment, she served as senior advisor to the chief deputy director, special assistant to the director, and in multiple capacities within the Division of HIV and STD programs. Prior to joining public health in 2005, her professional focus was on adolescent health while working in hospital, school, and community settings. Ms. Northover has a Bachelor of Arts in English with a minor in Classic Civilization from UCLA and a Master of Public Health in Community Health from New York University. Most recently, she completed a fellowship with the Health Equity Awakened Leadership Institute, sponsored by Human Impact Partners. So let's welcome, Heather.
Good morning, folks.
Hi, Heather. I'm going to go ahead and stop sharing if you want to go ahead and share your screen.
Let me try to figure this out. Hold on. Share.
There
Okay.
we go.
Oh, now you can see all my, sorry, you're all peeking behind the curtain here. Okay, does this work, folks? Awesome. Well, I'm actually, so I just want to thank you for allowing me to present. I'm going to do a brief or not so brief presentation, a little bit around why we're really focused on equity in the Center for Health Equity, the impact of race and racism on health, and then talk a little bit about COVID-19. I'm going to share a lot or some data during the presentation, and so we'll talk a little bit more about that and the implications for that. So I'll just go ahead and get started because I know I have not that much time. So in the beginning, I really just like to do a little bit of level setting and talk about how, I think we all want communities filled with the resources and opportunities needed to allow everyone to thrive. And all these things that you see on the screen, right, are needed, sort of in the words of Dr. Spock, to live long and prosper. And so, a healthy community obviously are places that meet the needs for everyone, basic hierarchy, Maslow's hierarchy of needs. So clean air to breathe, clean water to drink, affordable and healthy food, shelter and safety, obviously, adequate levels of economic and social development. So good schools and well-paying and safe jobs. Something that we're obviously seeing during this time of the pandemic, the really big importance of social equity and relationships that are supportive and respectful. And then lastly, obviously, sustainable and clean environments. So, I think for many of us who have lived in LA County for a long time and who obviously work in our county, we know that there are a lot of neighborhoods, right, across our jurisdiction that have these community conditions. And unfortunately, we do see stark inequities across place and race and ethnicity. These differences by race and ethnicity, by place or geography, and obviously income level can lead to an up to 12-year difference in life expectancy. So plainly put, right, depending on the color of your skin, where you live and how much money you make really determines whether we are more or less likely to have access to the things that we need to allow us to grow healthy. And they really lead to big differences in not just health outcomes, but quality of life, as well as longevity. So you see here on the screen, right, that there is a 12-year difference in life expectancy by place. So those who live in the community of Walnut, as well as those that live in the community of Lancaster. And then when you look at sort of race and ethnicity, you'll see a 12-year difference between Asian American community members and Black African American community residents in our county. One thing that I do want to point out about the data point for Asian American communities is that like all different communities, Asian American, Native Hawaiian, and Pacific Islanders are not a monolith. And actually, when you disaggregate the data for Asian communities, that you'll see even within that overarching community, you'll see a 12-year difference between individual ethnicities. So it really speaks to the importance of disaggregating data, and we'll talk a little bit more about that later on. When I talk about these differences, I do want to really emphasize that these differences are largely the result of past and present policies and practices really influenced by bias, by prejudice, by power imbalances, and it's really not the result of individual characteristics and behaviors. And we'll talk a little bit more about that as we move on through the presentation. I also just want to say that while we talk a lot about race and ethnicity, and we'll talk a little bit more about why we sort of ground our work in that, I do want to acknowledge that things like language and sexual orientation, gender identity and biological sex, physical and mental abilities, and our religion are also factors that affect our health due to similarly unfair policies and practices. And it's really important to think about the intersectionalities that we all live in and that we all have different identities that make up our unique experience. So now I'm going to talk a little bit about data. And I do want to acknowledge before we move forward that data has often been used and weaponized against certain communities to justify the inequities that we see in our communities. And so I want to acknowledge that. I want to also acknowledge that some of the data may be shocking. It may just be fatiguing because it may be something that you already know and that you already experience. And so it brings up a lot of emotions for people, and I want to be clear about that. I also want to emphasize that I think it's really important to also look at the data, because we are not going to be able to change things unless we face that there needs to be change. So I want to put that out there before I sort of move forward. Then the last thing that I do want to say is that, and this was said in a lovely manner by one of our colleagues, Tiffany Romo, in terms of how we think and look at data, right? So I think a lot of us, particularly those of us who deal with a lot of data, who look at a lot of data, we really become sort of numb to that information. And it's really important to remember that those numbers represent actual real people and lived experience, right? So there's faces behind those numbers. These numbers represent, you know, ourselves, our friends, our families. It's really important to humanize and think about the stories behind the data. So I'm going to share this. It's a little bit dated with older information, but it shows sort of outcomes, not just in health, but across all different sectors. So health, education, criminal justice, child protective services, and the economy. And what this represents is that there is inequities across all different sectors, right? And that the inequities that we see is not just institutional, but it's also just systemic. And it's not something that's unique to the health field. In this graph, what I did was I actually used white residents in LA County as the standard, right? And which is definitely considered a lot of times a dominant culture. And then compared it to Black African-American residents' experiences. And you'll see from this graph that Black African-American residents are 1.7 to 12.5 times more likely to have a bad outcome across systems in LA County. And again, I do want to emphasize this is not due to individual behavior and characteristics. It's about the things that surround us, shape us, and that a lot of these things are outside of our personal control. And what it illustrates to me is that this is a problem across the board. Something else more global is going on to actually be driving these differences in health outcomes. I also just want to share the next slide. It's not just comparing African-American residents to white residents. You'll see that the yellow line represents Latino Latinx communities. The blue line are Asian American communities, and you'll see the differences across race and ethnicity. I think when we talk about differences in health inequities or disparities, we often frame and talk about it from a deficit perspective. We always look at who's faring worse, right? And why are they faring worse? And what's the problem with that community, or what is driving those problems in that community? And I think what's important to think about is the inverse. Why are people doing better? Why are people having privilege or advantage? So I took the same slide here and actually flipped it. And so what it shows and what's said in a different way is that when you compare our communities of color in LA County to white communities, that white communities have only an 8% to 60% as much of a chance of having a bad outcome, right? And we never talk about that. We never talk about sort of that advantage and why that advantage exists. And so I'm not going to go a lot into that discussion, but it's just something that I would like us to think about and really process. Because I think that how we ask the questions and what we look at and examine are really important to think about how we're actually going to address and tackle the issue. So I'm going to talk a lot about what accounts for these differences and really talk about sort of the dominant narratives that are out there about why we see these differences in outcomes across our systems. And I'm going to focus on health for a second. And some of these narratives are things that you may personally believe, or narratives that other people you know, friends and family believe. And I'm going to unpack three main theories that are out there. So I'm going to actually be using infant mortality as sort of the through line example. So here in LA County, we have very disparate infant mortality rates. When you actually look at the infant mortality rates as a whole, right, we're actually faring pretty well. We're actually meeting or maybe exceeding the Healthy People 2020 expectations. But when you actually disaggregate that data and you look at by race and ethnicity, you'll see huge inequities. And so you'll see that in LA County, and again, this is a little bit older data, so I apologize, but in general, Black African-American infants are 5 times more likely than Asian American infants, and 3 times as likely as white infants to have to die before their first birthday, right? Again, these are infants, obviously nothing that they've done, right? And so why are we seeing this huge inequitable outcome among some of our youngest residents here in LA County? And so when people look at that data, right, people come to their own conclusions about why that is. I love this quote, and it talks about people need a narrative. They need to have a reason to make sense of the world that we live in. And if there isn't one that's offered, they'll often make something up. And so when people think about their worldview, a lot of it comes from their own values, what they observe and see, which may not necessarily be the whole picture of what's entirely going on. So I think a lot of people, or some people think like maybe it's biologically driven, right? That there are somehow Black women are passing along a gene or something that's affecting their offspring that gets handed down through generations. And so let's talk a little bit about that, right? So one thing that's really important to note is that there can actually be more genetic variability between individuals of the same race than between individuals of different races, right? So that's one fact. The other thing is that there's been a lot of studies done on the disparate infant mortality rates. And in 1997, there was a study that was done that found that babies born to new immigrants from West African nations weighed more than their Black African-American born counterparts, and were similar in size and weight to white babies, right? And for those of you who are familiar with infant mortality, birth weight is a big determinant of infant mortality. And so one way to say this is that our West African immigrants had babies that were more likely to be born full term, which lowers the risk of death, than their African American counterparts. So not necessarily related to biology, right? The only difference here is you have people who their experiences about living in the United States. They did a follow-up study on this in 2002, and the same researchers and made it an also different discovery that sort of added to that story. So they looked at the daughters of African and Caribbean immigrants who grew up in the United States. And they compared that to white women who had European immigrant parents, right? And they looked at sort of their babies that were born in the United States. And they found that the babies of the daughters of the African and Caribbean immigrants were smaller, weighed less, were more likely to be at risk for infant mortality than they were when their mothers gave birth to them, right? While the grandchildren of European women who grew up in the United States and who had immigrant parents actually weighed more than they weighed when their mothers bore them at birth. And so when you look at sort of that data, you'll see that it took just one generation, right, for that American Black-white disparity to manifest. So again, not biology. I think a common thing that people often think about is behavior or social economic status, right? I think it's something that we know has a huge impact on health. So let's talk a little bit about that. So when you look at sort of the differences between Black-white infant mortality rates, it actually can't be explained by social economic factors. So you would look at education level, right? Black mothers with a bachelor's degree or higher are more likely to have poor birth outcomes than white mothers with a high school diploma. Not about school. Prenatal care, right? Black mothers who received early, regular prenatal care were still more likely to have poor birth outcomes than white mothers who received late or no prenatal care. Smoking rates. Black mothers who did not smoke while pregnant were 2.8 times more likely to have a poor birth outcome than white mothers who smoked while pregnant. You can also look at insurance rates. Same thing. Black mothers who were privately insured still had higher rates of low birth weight babies than white women who are publicly insured. So again, can't be explained by social economic status. So I think the thing that we're really thinking about and examining is the impact of structural and systemic racism. And so, you know, what we are seeing and what we're really starting to examine and know is that policies, practices, and systems that really have contributed to and sustained inequities based on race, based on gender and class, are really at the root of the inequities in infant mortality and other inequities that we see. And they really impact also the resources that mothers are likely to have. This includes, right, historical inequities that have created intergenerational disparities and trauma still seen today and that reverberate in future generations. Chronic stress associated with racism is a critical link between social inequality and birth inequality. You'll see that repeated experiences of racism and discrimination can cause chronic stress in our lives. That really triggers psychological and physical reactions in our bodies. And these interactions and reactions can really affect our internal organs, our physical and mental health, as well as our long-term health and well-being. We see it in other conditions as well, including heart disease. And, you know, since racism also limits access to resources and opportunities, it's also a driver and compounded by exposure to multiple adversities that affect mothers' well-being and the health of their infants, including things like poverty, exposure to violence, and other compounding factors. And so, you know, I think it's important to look at the structures and how they impact people and sort of how systemic racism is not just a driver of poor health outcomes, but it also actually determines and leads to those other factors that put people at risk, including geography and place, as well as income level. I know when we looked at the data chart earlier, you saw that there was a huge disparities, particularly around incarceration. And there's been a lot of studies done, right, about why that is true. And again, I would say that, you know, our criminal justice system is really stacked against communities of color, particularly Black and Brown communities. And I think that we are now starting to see, right, this movement about decarceration and Black Lives Matter, because there's a real recognition that just by being Black, you're criminalized. And I think we've seen it in a lot of examples, right? Where just existing, doing the same things that everyone else is doing, like renting an Airbnb, meeting up with colleagues at Starbucks, right? Having a barbecue, right? There's a rash of all these incidences where people are calling 911 and the police on people who are doing, just living their daily lives and existing, right? And then by contrast, I thought this was really interesting. In 2014, when we were starting to see all these incidences of police murder, right? That there was a Twitter hashtag called Criming While White, where a lot of white people were going on Twitter and talking about what they were able to get away with because they were white, right? And I won't read some of these stories that you'll see on the screen, but some of them are super shocking. And it really shows sort of the privilege that, you know, skin color can have and how people are treated differently, right? And it's a really big sort of dichotomy, right? There's a lot of data, and I'm sure Diana could go on and on about sort of the inequities in our criminal justice system, from our legal system to our incarceration facilities. But again, we're seeing sort of systemic and structural issues that are really leading to higher rates of incarceration among our Black and Brown residents. And, you know, when I talk about sort of how race and ethnicity drives and determines place and geography, and drives and determines income level, talk a lot about sort of historical policies. So I think many of you have probably heard about redlining, right? There is, and I always give a shout out to this, for those of you who really have liked or heard of Adam Ruins Everything, he has a really great clip on YouTube from his television show that really simply talks about redlining and its impact, and I highly recommend that you check it out. But essentially, redlining is really about federal policies post-World War II that determined whether people could get a low-cost mortgage to enable them to buy a home, right? And you know, these mortgages really allowed people for the first time to put very little money down in order to invest in a home and then own that home outright, and then reap the benefits of sort of financial equity that was built up in that home and then could be passed on to generations. In order, at the same time, right, they actually created these maps that showed banks where they were considered good or bad investments. And banks would only give mortgages in the areas that were considered good investments. And those were in sort of the green areas and some of the other areas. And the areas that were red were not given mortgages at all, or mortgage loans. And when you look at sort of the historical documentation, which you can actually see online, and you can actually see the documentation, particularly for your individual neighborhood, they were very racialized language, and it really was determined about the density of people of color, whether it was considered a good investment or not, right? And so what happened is it created these communities where that were predominantly white were able to get mortgages, where people who were living in sort of redline areas were not. And what it led to is that 30 years after this started, about 2% of heavily subsidized mortgages made available by the federal government or Federal Housing Administration went to non-white households. So like 2% of non-white households were able to get a mortgage. And when you think about our homes or houses, in general, housing equity makes up about 2/3 of our generational wealth. And so the racial wealth gap has increased, and is actually rooted in the housing wealth gap, So in essence, this was federally sanctioned discrimination, which created a huge intergenerational disadvantage for Black and Latino Latinx families who were left out of the housing market. And this is important because it really leads to accumulated wealth, right? You buy a home, you build up financial equity, you're able to send your kids to a really good school. Kids go to schools, they build really good social networks that help them to get good jobs. They get good paying jobs, they're able to buy homes in better areas. Guess what comes with better homes in better areas? Better schools, right? And so those building blocks of intergenerational success gets paid forward. And when you don't have that from the very beginning, it's really, really difficult to catch up. You know, we also see it, as you saw in the graph, education. I know that you have a future session about education, but definitely you'll see inequities related to suspension rates. And you'll see that many studies have shown that African-American and Latino Latinx students are suspended at a higher rate for doing the same things or for doing less egregious things than their white counterparts. And then you'll also see in the workplace, right, in terms of thinking about how it determines wealth or income, that I think many people have heard about the study where resumes with white sounding names were called back 1.5 times the rate of resumes with Black sounding names, even though they were exactly the same. And you'll see it even in other studies where it shows that white applicants with a history of incarceration rates were almost as likely to get an interview and a job as a Black applicant who did not have an incarceration history. Really quick, I think when we think about COVID-19, it's a great quote from President Barack Obama about how the racial and socioeconomic factors are playing into the inequities we are seeing around COVID-19. And it's really laying bare the existing equities that these communities face. Recently, we released, the Department of Public Health, a report on the racial, ethnic, and socioeconomic disparities we see related to COVID-19, and some of the highlights you see here, whereas communities of color had a significantly higher death rates compared to white communities. People in areas with high rates of poverty had higher rates of death due to COVID-19 compared to communities with very low poverty levels. And the rates of COVID-19 infection are higher in lower income areas versus lower income areas. Infections are higher in lower income versus other areas. When you see sort of the death rate, this is a little bit dated data, but you'll see percentages, but you'll see sort of by rates that Native Hawaiian Pacific Islanders, Black African Americans, and actually Latino Latinx rates have also skyrocketed, where you see sort of inequities across race and ethnicity. And these are really driven by, you know, the social determinants of health in terms of economic insecurity, living conditions, access to health services, and underlying health conditions that are really putting our communities, particularly our communities of color, at risk for COVID-19 infection, as well as higher rates of poor health outcomes as a result, including severe illness and even death. So I am at time or over time. So I'm actually going to stop the presentation. And if you have any questions, please feel free.
Thank you, Heather. Does anybody have any questions? No, okay. Well, thank you, Heather, so much. That was great. A lot of great information. Oh, she wanted, there was someone on the chat that said, if you could please include a link to the YouTube video on redlining.
Actually, if you don't mind, Heather, quick question. Thank you so much for what you've shared. I was just wondering, is there any other factor aside from COVID-19 and the pandemic that have kind of pushed the material to the forefront of our consciousness around inequities, around health and disparities and everything else? Were there any pre-existing concerns that we had and have just been amplified by current state of the pandemic?
I mean, I think that whenever you have an emergency, we see that communities with less resources and more stress fare worse. And I think it's a pattern that we see, unfortunately, historically and presently. And so it wasn't necessarily surprising that we saw it with COVID-19. I think that because in essence, the world has stopped because of COVID-19, that I think people have started paying closer attention. And then given sort of the uprisings and protests around police brutality and the murder of particularly Black men and women, have really pushed this to the fore. I think in areas that we've seen it in public health in the past, really around in the early 80s and the 90s around HIV, AIDS epidemic. We saw sort of inequities related to LGBTQ plus communities, but then as the epidemic wore on, we saw that, Black, brown communities were being harder hit. And so I think it's a pattern that unfortunately we see throughout history related to sort of public health epidemics, pandemics, that these social determinants of health and larger structural and systemic inequities really drive the inequities and poor health outcomes that we see.
Thank you very much.
Yeah, thank you, Heather. And yeah, if you can just please, put on the link to the chat, to the YouTube channel, because I think people are really interested in seeing that. So if there isn't any other questions, I want to thank Heather for your time. I know you have a busy schedule, so thank you for making time to come out and give us that very important and informative information. So I really want to welcome now our second speaker, Diamond Lee. Diamond is an associate clinical social worker with a master's in social work. She is a race equity advocate, trainer, and consultant. Her academic and professional career have focused on applying a racial equity framework to a range of systems change efforts, including criminal justice reform, Black infant and maternal health, mental health, and other social problems. She has extensive experience managing a portfolio of projects that leverage government, philanthropic, and community resources to advance racial justice. Ms. Lee has facilitated the development and implementation of a racial equity agenda for several teams and initiatives, including the application of a racial equity framework to the Los Angeles County Alternatives to Incarceration Initiative, South Los Angeles Regional Center, and Los Angeles County Health Services. So with that, I welcome Diamond Lee.
Thank you. And thank you, Heather, for that presentation. I think it was really grounding, especially with data. Let me pull up mine. Let's see. This is not what I was trying to pull up. Let's see. 1 second. Here we go. There we go. So yeah, thank you for that introduction. As mentioned, I work with LA County Department of Health Services. I am Diana Zuniga's counterpart, working formally within the Whole Person Care program. And I'm just excited to be here. And I thank you for the invitation to be here, because this is like a lifelong passion of mine. And yeah, just given the moment that we're in, it's really exciting to see these conversations happening, and also just long overdue. So just again, happy to be here and present this work. So what I'm going to be talking about and focusing on is just how to apply a race equity lens, or what does it mean when we talk about equity, race equity, and also in the context of like racial trauma, because we talk about this a lot of times from like an organizational systemic perspective, but also understanding like what racial trauma does on an individual level, which impacts health, which is why, again, another connection to why we need to do this work. And so after kind of discussing those things, hoping to offer up kind of some steps forward as you within your organization think about applying an equity. I use equity, race equity interchangeably lens, and then also just sharing some of the work that is currently happening within the Department of Health Services around race equity. And please feel free to ask questions in the chat box. I don't know that I'll be able to see them, but I will definitely address them throughout the presentation or at the end. So what is racial equity? So I love this definition from the Center for Social Inclusion. They describe it as both an outcome and a process. So as an outcome, we achieve racial equity when race no longer determines one's socioeconomic outcomes, when everyone has what they need to thrive no matter where they live. And as a process, we apply racial equity when those most impacted by structural racial inequity are meaningfully involved in the creation and implementation of the institutional policies and practices that impact their lives. That's a mouthful, but basically, this is why I use race equity interchangeably, because it's just about everybody getting what they need. And we know, historically speaking, Black, Brown, Indigenous folks are the groups that do not on a consistent basis get what they need, so that they can have the best life and thrive no matter where they are. And then again, as the process, just simplifying the definition, it's those that are most impacted leading and designing the changes that need to happen on behalf of themselves and their community. So what is racial trauma? So, we think about trauma a lot, and we understand trauma, we talk about trauma-informed approaches, the impact of physical abuse as a trauma, emotional abuse as a trauma, just different stresses that we might have in life that we understand as trauma. But this concept of racial trauma is very important because there's so many people right now experiencing, well, people have already been experiencing racial trauma, but the impact of it is more potent right now, given the moment that we're in. And so racial trauma can be viewed as race-based stress. It's a stressful impact and or emotional pain caused by racism and discrimination. This is fact, and just as other traumas over a long period of time, without any positive mitigators, it can be toxic and it can have an impact on your physical and mental health. Racism has an impact on your physical and mental health. Heather was talking about the implications and the manifestations of that in her presentation, but just wanting to really elevate that just as, physical abuse, emotional abuse, things that we, connect to trauma, domestic violence, different experiences that we connect to trauma, racism is a trauma. And also just understanding that just because the individual witnesses or sees racial stress does not mean that it'll be stored as a trauma. So I also want to put that there as well. So again, can't talk about racial trauma without kind of identifying what triggers it. Again, given the moment that we're in, if we're talking about at an organizational level, or institutional level, like culturally incompetent care. So folks, walking into a healthcare facility, if we're using the example of African-American women, Black women going into healthcare facilities, not being believed, not, feeling like there's some bias against them, not getting the time they need, they store that, and also this idea that, when we talk about culturally competent care, a lot what we know to be interventions for people of color were not necessarily for people of color when they were created. And so when we talk about evidence-based treatment, it's like evidence by who, you know? And that a lot of time dismisses a lot of the practices and cultural rituals or things that people bring through their own culture to help heal them, right? That can be dismissed a lot of time. I mean, also just diagnosing. At the institutional level, we see a lot of folks, you know, we look at young Black boys being diagnosed with ADHD over and over and over, and that sticks with them, as opposed to being diagnosed with trauma. And so these things, you know, over a lifetime, you know, can initially be just a stressor, but become an actual trauma for people of color. Another level of institutional trauma is like leadership. You know, again, we're in a moment where there is an opportunity to do some real work to advance racial equity, social justice. And so we're seeing, you know, diversity, equity, inclusion, DEI pop up everywhere, you know, as an immediate response. Let's do implicit bias training. And so though some folks might have some great intentions around this, when you're checking boxes, that is very traumatic for staff of color. You know, when you're saying, oh, you know, we're gonna hire a consultant, we're gonna do these trainings, we're gonna facilitate these sessions, folks can feel that, you know, and that is a trigger for people of color within organizations because, one, you've been subjected to a lot of inequitable policies and practices, you know, across time. And then now it's like, oh, now you as an institution believe me. And now, oh, you're giving these, you know, Band-Aid, you know, these Band-Aid solutions to address it. And so, you know, just being mindful of that as you think about, you know, within your own organization, if you are a leader, you want to be authentic. And again, going back to racial equity and what that means, if you're really trying to create or address or advance race equity on behalf of your organization or your community, you need to be involving those that are impacted. Don't just come out with solutions without involving those that are impacted. And so that's the high level kind of triggers, but also want to discuss the interpersonal, which is microaggressions, which a lot of times aren't so micro, stereotyping. If somebody is talking about an experience of racism and then someone else rejecting that, that triggers racial trauma, you know. And then also, you know, this is one that I do want to emphasize as well is, you know, white or white past people, you know, waking up, you know, finally being at like, oh my God, this is a thing, I have to do something, you know, and that's great. And that's a trigger for people of color who've experienced this across their lifetime. And so just, you know, being mindful of the waking up, this moment now, you know, it's great that people are waking up, but it's also a trigger for people of color who've known this their entire lives, you know, for generations and generations and generations. So I just thought it would be helpful, you know, to talk about race equity, talk about racial trauma, so that we're understanding it in both an individual and a collective context. So why use a racial equity approach? Again, I use race, equity interchangeably. Why is it important to, when whatever we're doing, when it comes to programming, client care, you know, systems change, why is it that we center race? And so I love this graphic here because it just kind of speaks to kind of connecting again to what Heather's presentation was. You know, our country was founded on racism. There's no, you know, arguing that, where, you know, land was stolen, folks were seen as less than human, you know, 3/5 of a person. This is just embedded into our history, you know, and our policy and our practices. So unless we're undoing the racism that was within our history, a lot of what we do will be surface. Another thing is just like across every, social health indicator, Black, brown, and or indigenous folks are at the bottom. So there's just you can't ignore race. You can look at, folks want to talk about, education, poverty. Again, look at African-American infant and maternal mortality. Outside of, education, income, Black women with PhDs are faring worse than white women, with no high school degree, so these things are across the board, poor racial outcomes are across the board. And then, there's just, we know implicit bias is a thing. There's a lot of assumptions about different racial cultures. And the more we ignore them, again, the worse off we'll be. So this graphic I just love because it shows that another thing about race equity and why I use that interchangeably with equity is because race equity allows you to apply an intersectional approach or lens to the work. If you center race, you can also apply ethnicity, religion, gender identity, like all of those things can also, it allows for that intersectional approach. And then finally, this piece around targeted universalism. So universalism is the idea that we have a universal goal. I want to, I want to address the school to prison pipeline. That's great. Targeted, approaches, that's, I'm going to target youth ages 5 through, 15. I'm going to target Latinx youth ages 5 through 15. I'm going to target Latinx youth that are in this particular community that is actually more disproportionately impacted than others, ages 5 through 15. Using a universal goal of, I want to address this, huge thing of the school to prison pipeline, and then taking targeted approaches and applying a racial equity lens allows you to do that. It allows you to really target and then expand from there potentially, but it's a more equitable way of addressing system change. Now I'm just gonna stop there. Any clarifying questions? I don't see the chat box or comments.
Don't worry, Diamond. We'll be able to field the questions.
Okay, okay, thank you.
Go ahead.
Great. Okay, so kind of going into kind of what we can do moving forward as organizations.
Diamond, real quick, we do have a question. Just, I guess we have it all. It says, Ben, maybe Cecilia or Yana, I just saw it pop up, but I can't find mine.
The question is, how can you avoid the check the box feeling? And then we have a comment from Tosin. I hope I'm pronouncing your name correctly. Great so far. Would love to get a copy of the PowerPoint if Diamond is willing to share.
Yes, I am. I am. Yeah, I will share. Thank you. So again, it goes back to process, engaging those that are most impacted by the issue. And so, and that can mean you could be an organization or a program manager, and you are a person of color yourself. But again, you cannot tokenize yourself. It's not just about you. It's about, again, engaging as many people that are impacted by this issue in the process for change. That's how you really avoid the check the box and, syndrome. And, elevate them in their leadership and leading it. It's not just about getting their ideas, but allowing them to lead out on it as well, because that's how you're going to get buy-in, and that's how, you'll really advance the work. Okay, so and again, I hope this helps as well address that question. This was taken from a presentation, and I'll talk more about alternatives to incarceration. But myself and Danielle Deploy of $1 Million Hoods, we created this kind of framework that we call the cornerstones of racial equity within an organization or an institution. And so first it starts with, creating a culture of racial equity. That means like leadership committing to doing this and having the analysis that is shared within the organization. So that can mean, doing some foundational trainings, committing to kind of having affinity groups, like doing the work to start to create the culture within your organization is an authentic practice, to just not check the box, but actually commit, publicly commit, and then create the organizational shared analysis and language around the issue. Applying a racial equity lens. So there's tons of racial equity assessments to inform policy, programs, and practices. I do have resources at the end that can kind of guide you to where some of those exist, where they live. But yeah, using like a racial equity lens or assessments, one, to know your organizational readiness or where your organization stands, but also as you create new programs or you're changing your policies, these assessments and these tools help guide you through a process to do that is based in a race equity framework. Be data driven. So collecting race data, that's very simple. A lot of folks don't do it, but if you just started to collect the data, you would see right off the bat, the disparities that exist. And it helps you to understand, well, before I say it helps you to understand, I'll say that it's important not just to collect it for the people that are walking into your doors or who you serve. It's also important to collect it for the community. Because if you are in a community that is, let's say, 50% Black, 20%, Asian Pacific Islander, 30% Latinx, and you have 80% Black people walking through your doors, like, unless that's your program, MO to only serve Black people, then there's something off there, just the same. If you have 30%, Latinx folks in your community, and it's 100% or 90% Latinx folks walking through your doors, how are the Asian Pacific Islanders receiving services from you? If you're providing a basic, substance use service, mental health services, this is why it's not just important to just collect who's walking through your door. It's also important to know who's in your community and have that data. And again, with that data, you will definitely, the implications will be clear. And again, these tools can help walk you through how to use that data to engage the folks that you need to engage, so that you are providing the service that you need to provide to everyone in your community, or that you're making sure that your provision of services is appropriate for everyone who's walking through your doors. And then again, community collaboration. I think I was kind of speaking to this before, and I think these racial equity tools also, they help you to create processes for community collaboration, but you just cannot do this work. You cannot do this work. You cannot do this work without engaging the communities that are impacted. And that means engaging them as you collect data, so reviewing the data, planning what the programs will look like, looking at implementing the programs, and then also evaluating the programs. And I'll give an example of kind of like the power of community collaboration, because, not only does it help to create the best programs and services and centers it in what the community actually needs or wants, but also there's the buy-in. The community is engaged in the process. They buy into, the program, the policy, whatever it is. So it's just critically important. And then also, not stopping at just collecting data, engaging the community, using a racial equity tool. This is an ongoing process, and it needs to be embedded into your culture. So building in opportunities to constantly, re-engage the community, constantly look at data, see what progress is being made. What are some of the unintended consequences of, the things that we've done? So we can reflect on that, we can learn, we can improve. It doesn't stop. And so this again is how you as an organization, it's a lot of work. It is. I mean, Diana and I are on a team where this is all that we did. This is our full-time job, you know, to incorporate this stuff. And so people are like, well, you know, we're a small nonprofit, you know, we don't have that many. Like, this needs to be prioritized. This is like the bread and butter of the work that people do. So if you can't, I understand the issue of like providing the services, service delivery, you know, we only have a certain amount of staff. But this really should be a priority within every organization, because I just cannot see how an organization or an institution, department is being effective in their work without doing these things. Any questions on just this piece? Okay, I'll just quickly go through these because I know I'm like probably out of time. So what we're doing at DHS, so staff development and organizing. I talked about like racial, you know, trauma. I talk about race equity. A lot of folks are like, well, what if I'm the only one? You know, what do I do? You know, it's just me. I would not recommend you like screaming to the rooftops by yourself, because that's traumatizing for you. But what you can do is find like-minded individuals within your organization, within your network, to start to build your analysis and do, you know, the work. And so that's what our team was able to do, the collaboration team within the Department of Health Services. And so as we started to like do our own development work around race equity and started to like organize amongst ourselves, these opportunities that I'm going to speak to next, they started to come up, and we were ready. You know, we just jumped in and we were able to do this race equity work because we had already done the pre-work. And also we had we're a support system for each other. And so that's really important as you move this work along, especially as people of color, because this work, it can feel traumatizing. There's times where you want to tap in and out of it, and that's why there needs to be a network of folks to really hold it. And so with Alternatives to Incarceration, which Diana leads, their race equity was listed as a value. We apply the GARE, the Government Alliance on Race and Equity, their race equity tool to the process. And through that, we were able to develop racial equity commitments. And that is also being incorporated currently as we work to on board motion 2, which looks to reduce the jail population even further. And so again, applying a racial equity lens and making sure that's being incorporated into that process. And also within that initiative, I should have added, there is the Reentry Health Advisory Collaborative. So when we talk about engaging folks that are impacted, this collaborative is 11 individuals that have been impacted by incarceration, formerly incarcerated folks who also advise on this work. And we continue to pull into spaces so they can be a voice of the community and those impacted. Also the AIM initiative, which Heather talked about, but I will just add that, you know, there are community action teams. So these are folks, grassroots, you know, action teams that look at within communities that are impacted, that is the South LA, that are most impacted, South LA, Antelope Valley, but it's now even expanded further than that. There's several other community action teams. We're really looking at a regionalized effort, looking at how we can reduce African-American infant and maternal mortality, and looking at ways that work for those particular communities, not trying to apply one brushstroke countywide, you know, countywide solution, looking at what works for each community. And there's also a doula pilot project, which serves African-American women. It started within SPA 6, 8, and 1. Now it is in across the county, but this pilot was something that came out of the community action teams. This is what the community wanted. And then finally, within DHS, there is the COVID-19 testing equity team, which Diana and myself are on. And so, you know, we really look to have equity-centered communications. There's an organizational capacity building project that we're working on, and that really is looking at how do we fund the organizations that are in the communities that are most impacted by COVID, that serve the communities most impacted by COVID to actually do the work that they're already doing and make sure that communities are getting what they need so that it doesn't spread further. And then ongoing community engagement, and that's just a cornerstone of the work that our team does. And finally, these are just some resources. There's like implicit bias trainings. There's this great, I always like folks to start with white supremacy culture. This is a great tool that organizations can use to kind of see how white supremacy culture shows up within their organization. And even as individuals, this is great to use to kind of look at being kind of characteristics of white supremacy cultures, and then it has antidotes, so ways that you can combat that and do things differently. It offers that. There's a racial and ethnic stress and trauma survey. A great book is by Resmaa Menakem, My Grandmother's Hands. Racial equity tools, that's the website that you can go to, and there's plenty of assessments, resources that you can use for yourself around race equity. Where do I start? Where do we go? And then if you work within a government department, I would, even if you don't, the Racial Equity Alliance, so Race Equity in Government, GARE, that's a great resource to see what folks are doing across the country around this issue. But also they have a lot of publications to guide you through doing this work. And I love quotes, excuse me. So I have this one from Martin Luther King: "Injustice anywhere is a threat to justice everywhere. We are caught in an inescapable network of mutuality, tied in a single garment of destiny. Whatever affects one directly affects all indirectly." So we are all interconnected in this. And then all of our silences in the face of racist assault are acts of complicity. So this is just not a time for anyone to be quiet, given the moment that we're in, because if you're quiet, you're complicit in racism, honestly. So we just have to push ourselves. It's hard work to do the work, but also take care of ourselves in doing it. And that's it. And this is my contact information if you all have questions, any further questions, and I'm happy to take some now if there's time.
I do have a question, Diamond.
Yeah.
In regards to, you were saying, don't use the checkbox, don't fill in the checkbox, include the individuals who are impacted by these in your organizations to start kind of the work and the planning on how, not bringing consultants. And so how do you approach individuals who are impacted, by racism to the table without, feeling like they might get offended? How do you do it tactfully?
Yeah, that's a good point, because not everybody, people are tired, and they are feeling like they're feeling the trauma. So not everyone has the capacity to engage in creating solutions. I would say, first making sure that you are very clear as leaders of an organization, what you have, the internal reflections that you have done, and being transparent about that around why this is needed. To make sure that it's coming from a space of like, I really want to do this, not I have to do this given the moment that we're in. So if you're being authentic in that as a leader within an organization, I think that's the first start. And then I think it would just be, putting the call out, like, this is what I'm seeking to do. I'm seeking to develop a process to address the harm that could have occurred within this organization and the racism that we know that's happening within our community. And I know that there's leaders within my organization doing this. And so wanting to pull you all in and co-leading this work, with leadership and co-designing what this will look like for leadership. So making it an open call, definitely not going up to people, handpicking them or saying, hey, do you want to be involved in this? But yeah, just opening it up to folks who are interested in doing the work.
And Diamond, if I may, first of all, thank you so much for what you've imparted to us. And you certainly seem to have a great quality of presence in terms of how you communicate the information and get the message out. And my question is, and you mentioned kind of around the network of folks that are maybe needed to move this topic forward and to really do it justice, if you will. To briefly quote or paraphrase Maya Angelou, when you know better, you do better. So in essence, perhaps is it possible that we're seeing folks not doing better because they don't know better? And will it take information and informing folks so that they know better, such that they may actually end up doing better around race relations and interpersonal interactions and the like?
Yeah, I mean, again, that's why I just go back to like this organizing sense, because if you are seeing that there are folks that are perpetuating harmful practices, you know, racist practices within an organization, it is a lot for a single individual to address that. And you can you know, bring it up to someone and they might not see it within themselves. And so it's like what folks have the capacity to do. And when I say organizing, it's not necessarily just organizing amongst all staff of color, it's organizing amongst, you know, white ally staff, you know, who've done their work, who are open to like hearing, you know, feedback, who don't think work needs to be centered on them. But it's just, yeah, it's important to organize, because otherwise you will not be safe trying to do it on your own with leadership, you know? And sometimes, yeah, like sometimes folks just aren't gonna be there, you know? And as opposed to focusing on, I think this is the approach our team took, as opposed to focusing on the highest levels, trying to make them feel like there needs to be an Office of Race Equity or all these racial equity initiatives. How can you start small and then build out from there, right? Like our team started with just us. It was a group of, you know, 8 of us that said, this is important to us. And then here we have this whole initiative on African-American infant and maternal mortality that we were able to engage in, that aligned with our values. Here we have alternatives to incarceration, which, you know, race equity was able to, so it's expanded, you know, just from a small initial effort. So, and again, even within these initiatives, not everybody is on board, you know, with the messaging, right? But it's beyond them at this point, you know, it's beyond them. Yeah.
Excellent. Thank you so much. Definitely. You're absolutely right. Thank you.
Do we have any other questions for Diamond? And if not, her email's there. I think she's gonna definitely provide us her PowerPoint, because I know I want it. You have some great information.
I was there.
Thank you, Diamond, so much. Yes, it was a lot of great information.
Thank you. Happy to be.
Moving forward, we are going to kind of do something a little bit interactive. We have a poll. Remember, everything is anonymous, okay? So don't worry, it doesn't let us know how people, you know, answered the questions. So I think Cecilia is going to be putting up the poll.
So I'm having technical difficulties with the poll. For some reason, it's saying that it's inactive.
Okay.
So if there is any, the next item on the agenda was additional questions. So if you still have questions, maybe we could do that. And then if you could give me like 2 minutes and maybe I can pull up the poll questions.
Yeah, definitely. If there's any questions at all anybody has, or want to just make any comments, something you enjoyed, or any surprising information, please feel free to take this time.
And also if there's any suggestions for the next one, please feel free to put it in the chat or let us know.
While we wait,
Sorry.
I was gonna say, while we wait for Cecilia, I guess we can go through our call to action. You know, we had 2 speakers today discussing information on racial equity, a lot of great information, you know. So, you know, the purpose of these town halls is at the end, we hope, you know, individuals go back to their organizations or even within themselves to do something, you know, and this is the call to action. This is the time, like what Diamond said, we can't stay quiet, right? So definitely our call to action is to kind of encourage you all to, you know, join your community leaders as they share data and address underlying inequities. You know, you can contact state senators, becoming informed of the past, understanding, you know, what's going on now, and then moving towards, okay, this is the transformation we need, you know, for the future. And then definitely serving as a change agent within your community, as an individual, and, you know, as someone who, you know, where you work at, you know, in your organization, if you see any, you know, injustice, racial injustice going on, you know, being that change agent and moving forward to make those changes in your organization. And I think, I guess we'll just wait for Cecilia. Yeah, and Diana even said, please share any call to actions you have happening in your community, you know, in the chat, you know, or, you know, feel free to unmute yourself and, you know, share anything that you're doing or your organization is doing.
Yeah, and hello, everyone, this is Frank. Just to take responsibility for earlier technical difficulties. In light of the poll challenges we're also having right now, we'd actually like to communicate the essence for it or the purpose for it. So even looking forward to subsequent town halls, we're aiming that the questions that are posed in the polling from the audiences that are registered attendees give us a sense of their own experiences at times, or questions may be posed relative to their understanding of how things might be or might not be, as well as getting a sense of person to reflect on unique experiences that they may have, and how towards the end of it, when the information is pulled together and aggregated, to really look at the consistencies or inconsistencies or some trend lines around certain topics and certain experiences that folks may have. So keep in mind that the poll feature is going to be something that will be consistent across the town hall series, all 5 of them, in fact. And so this will set the stage for the purpose, intended purpose for it. And again, as we look and increase the number of town halls and the topics therein, drawing from the guest speakers, for example, today's guest speakers, Heather and Diamond, and then subsequent ones around education, everything else. So each particular segment will be content specific, and as well as containing overall and cross-sectional features querying about social injustice and inequities and disparities that are relevant to those particular topic areas. All right, so that's one of the features, again, we wanted to highlight in terms of the utilization of the poll feature. Even despite having a little bit of technical difficulties, that's okay, but we want to make sure that the essence of it is understood and appreciated moving forward as well, okay? All right, so then, and in fact, they may have been mentioned, but also in the chat feature, a lot of the resources that folks have available to them or know of, they can include that in the chat feature, wherein certain contact information can be provided of key figures that pertain to different aspects of discussions that we've held so far. Okay. All right. Alicia, back to you.
So again, I guess we're just gonna wait for Cecilia. She's gonna try, but just a little reminder that our next town hall is on July 23rd, and the topic it's gonna be on education. So please, if you haven't, you know, registered, go ahead and register. We will send another invite and reminder everyone. And so we look forward to seeing you all at our next town hall on the 23rd.
Hi, everyone. So I am able to do the polls if you still want to do it.
Yes, please. All right.
Okay. So,
Where you see it? Okay. Oh,
Yeah, we saw it.
thanks.
all right. So everyone go ahead and take a moment to respond to the poll.
I don't think we, oh, there we go.
Um,
This one happens to be a multiple response option. Question reads, please indicate any all areas in your life that have been impacted by COVID-19, and you can choose as many as apply. We'll go ahead and make a couple of responses. And then when you've completed your responses, go ahead and hit submit, please.
okay. There's 2 folks that haven't responded. If everyone has responded, I'll go ahead and end it. So we're gonna share results. Can you see the results?
Yep.
Yeah. All right, so it indicates that to the question, please indicate any all areas in your life that have been impacted by COVID-19. It seems that 18% of us indicated our health has been impacted by COVID-19. Bulk of our responders, 91% in fact, indicated that their work or employment has been affected and impacted. Getting tested for COVID-19 comes in at 18% of our respondents. Relative to childcare, it seems 9% of us have felt the impact in that area of our lives. With respect to mental health, it seems 64% of us have expressed the impact on their psyche or emotional state, if you will. And then close to that also is physical health at 73%. And it could possibly be by virtue of the restrictions of mobility that have been ordered. Next to that would be the nutrition factor of 18% of our respondents indicated that they're impacted by COVID-19. Could also mean, for example, convenient foods, or it could also be the opposite in terms of having to cook more and be more selective in our groceries and selection of food items. Lastly, for this particular polling question, family relations is significantly up at 82% of us indicating that our family relations have been impacted by the COVID-19 pandemic, which is very relevant, of course. And in fact, all of these items and response options are relevant. And this is, again, to reiterate the purpose, to figure out and to put into a means of describing and being able to depict the areas of impact that COVID-19 has had. So I appreciate everybody's participation in the response in responding to these polls. And again, these are items of interest that we will be drawing upon and asking folks throughout the town hall series to get a sense of where things are per individuals' experiences. And also there'll be some in terms of options for contribution of how things should move in a direction should there be opportunities for systemic change. All right. Thank you.